Good evening and welcome to Uncharted. In tonight's lineup, it first became known to the world as the mysterious Chinese flu.
As most of the nearly 300 confirmed cases are at hospitals like this one here in Wuhan, ground zero for this mysterious virus. And it's also showing up in other cities as well as Japan, Thailand, and South Korea.
担心呢？
哦，为什么呢？
那担心怎么隔离了嘛？
戴口罩了，现在目前为止是甲型流感。
哦，那会担心再不久春运会担心这个病要扩散还是怎么样？
肯定担心的，现在是高发线。
Tonight, the city of Wuhan, the epicenter of the outbreak, is racing to contain the potential spread of a deadly new strain of coronavirus. And now, a disturbing development. China today says it has confirmed cases of human-to-human transmission of the mystery illness. In one case, a hospital patient is said to have infected 14 medical workers.
Chinese health authorities are still working to identify the virus behind a pneumonia outbreak in the central city of Wuhan. According to authorities, the number of cases has increased to 44, with 11 of them in serious condition.
The mystery virus started here in the city of Wuhan. Chinese authorities pinpointing its source to this food market. Dozens have been infected, but experts here believe the actual figure is closer to 1,700 cases.
And then our lives as we knew it changed forever. The World Health Organization declared a public health emergency of international concern on the 30th of January 2020. They then declared the disease a global pandemic on March 11th of that same year. Multiple variants have emerged and become dominant in many countries since then. Alpha, Beta, and Delta, which to date has been the most infectious and lethal. Now there's a new variant in town. They've called it Omicron. Omicron was first detected in South Africa on the 25th of November 2021 by Dr. Angelique Coetzee, the chair of the South African Medical Association. Within a week, the World Health Organization confirmed that the world was dealing with a new variant of concern. Within hours, governments around the world imposed travel bans and restrictions on countries in southern Africa, including Botswana, Zimbabwe, Namibia, Lesotho, and South Africa itself. Borders were shut and numerous flights were cancelled to and from the region, leaving thousands shocked and stranded at local airports. A response that didn't go down too well with South Africa's government officials.
We are deeply disappointed by the decision of several countries to prohibit travel from a number of Southern African countries, including our own, following the identification of the Omicron variant. This is a clear and completely unjustified departure from the commitment that many of these countries made at the meeting of the G20 countries in Rome last month. The only thing the prohibition on travel will do is to further damage the economies of the affected countries and undermine their ability to respond to and also to recover from the pandemic.
At no stage did they say that they've got evidence that, firstly, that this virus is more transmissible. They simply said that just as it has been the case as other mutations which has happened. Some of them have had the effect of being more transmissible without necessarily also meaning that in terms of its seriousness, in terms of having more impact in terms of the severity of illness. That's why we are saying that the reaction of some of countries in terms of imposing travel bans and such measures are completely against the norms and standards as guided by the World Health Organization.
On the 28th of November, the South African government came out strongly against the travel bans imposed on their country after the existence of the Omicron variant was announced, saying that such moves could deter other nations from reporting new variants. It's important to note that at this time, the South African Medical Association had only detected the presence of the Omicron variant, and they were the first to sound the alarm. There is no evidence to prove that the virus originated from that country. Since the emergence of the SARS-CoV-2 virus, tremendous efforts have been focused on sequencing the viral genome from samples collected throughout the world. South Africa has not been slow in contributing to this research. In fact, South Africa has one of the best genomics research laboratories in Africa, and so it should have been no surprise that they, or any other nation with this advanced technology, would eventually report the development of a new variant, considering that it is what viruses do. They mutate in order to survive, and it's up to researchers to stay on top of their surveillance game to report any new oddities. But still, even in knowing that, governments within the West and Europe immediately cut themselves off spur of the moment, with not even so much as a warning to their own residents.
President Biden wasted no time barring air travel from 8 African countries as the U.S. assesses the new coronavirus strain that was identified in South Africa. The restrictions start on Monday and apply to non-U.S. residents.
The Health Secretary Sajid Javid says scientists are deeply concerned about a new variant of coronavirus that's been discovered in South Africa. As yet, it hasn't been detected here in the UK, but the government is now suspending all flights from South Africa, Namibia, Zimbabwe, Botswana, Lesotho and Eswatini.
Amina Kaunda is a UK citizen and a nurse by profession. She is married to a Zambian national who resides in the UK. Her husband recently returned to Zambia to attend a funeral and was set to return home on the 27th of November when the UK government suddenly announced that travel from southern African countries was banned and airlines cancelled flights without even so much as a warning or compensation. What was your first thought upon hearing that the flights were being cancelled for countries within southern Africa? As Zambia wasn't on the red list at the time, but the flight that your husband was set to board was actually cut. So what were your first thoughts?
It was just sheer shock in the beginning, because it was never on the watch list even, let alone be on a red list. And for it to change so suddenly and his flight to be cancelled instantly, it just was, how am I going to get my husband home? You know, he needs to come back and be with his wife and children. So yeah, just shock initially.
We now know that he made it home safely. Did he have to go into quarantine? And if he did, for how long?
He's currently in quarantine now. He went in last Monday and he'll be there till next Friday. So I think it's 11 days he has to be there, because the first day they don't count. So it starts at midnight. Then that's your day one. So it's an extra 11 days that he's not home, but he is in the UK.
Do you think that the UK government's response to the Omicron variant announcement was actually valid?
So I am a healthcare professional, and with what they've done previously, I can kind of understand why they've done it, but it's very unfair, because they haven't done this with any other lockdowns. We've had maybe 48 hours notice, 2 weeks notice in some instances with changes. But for us to have less than 12 hours, and he's clearly not going to get on a flight and land on UK soil in that time. And it was Dubai that instantly shut their borders. They shut their borders before Zambia actually went on the red list.
So now, what has the public response been like back home? We've seen a lot of footage of UK residents in South Africa trying to get onto the flights, but then in the UK itself, what was the response like to the announcement and then also the cancelling of flights?
It's old news. They're bored of it. They're bored of all of these stipulations being put on people's rights and liberties. They're bored of being told what to do. People are fighting back against it now, especially with Christmas coming up. The government are saying just carry on as normal, but they told us to do that last year and then shut the country down over Christmas. So people were very, very isolated over Christmas, and that's a time for family. And so people are just thinking it's going to happen again, but people I've spoken to are like, I don't care. I don't care what the government are saying now, because it's just here. COVID is never going away. There's always going to be a new variant. It's a virus. That's what viruses do. They mutate and they change and they adapt to the situation that it's in. So that's why it's a different version in different countries, because there are different hosts for the virus to be in. But yeah, people are kicking back this time.
Do you think we'll ever see a day where this will become mandatory, this vaccine? Because that's the conversation that we're looking at now, which is mandatory vaccinations. Do you think that's looming in the distance?
So the vaccine's already mandatory for me because I work in healthcare. If I didn't have my vaccine by November of this year, then I didn't have a job. But the government is saying that they're not going to make it mandatory for everybody else. But that's what they're saying at the moment. So who knows? I think it's a good idea to get vaccinated. That's the reason the world has carried on for as many years as it has, because of the vaccines. People are scared that it's a new vaccine and they don't know what's in it. It's not. It's a really old vaccine. It's just been adapted to the virus that we have at the moment, which is how they work. But, you know, I understand people's personal choice, and it's up to them if they get vaccinated or not. But if you then become severely unwell and expect the NHS to look after you, which is free healthcare in the UK, you don't pay for healthcare in the UK, I don't think you're entitled to it. If you're not going to protect yourself and those around you, then why should you have the same rights to healthcare that everyone else does that has tried to protect other people?
There is still so much to understand about the mutations that make up the new Omicron variant. Most studies of the coronavirus strains focus on the spike protein, because this is what the virus uses to attach itself and penetrate human cells. If the spike changes too much or in the wrong way, it could render our novel coronavirus vaccines less effective against severe disease and death. The Omicron variant has 50 mutations noted in its spike protein, which is why the WHO called it a variant of concern. But just how concerning is it, and are the international communities warranted in their impulse responses? Still coming up.
So this is a really, really difficult call, and I think the problem with the Omicron variant is that there's a lot of unknowns at the moment. You know, we've been seeing the situation in South Africa.
My name is Tal Mukupe, and this is Off the Bench.
Where do I start? Do you want me to start from the beginning?
But at the moment, I'm not that consistent with the diet.
So Tio, for the Caddies tournament is on at 0800 hours.
Hey. I'm simulating the fans being back in the stadium, so we are getting excited.
All about every single sport you can put your hand or mind to.
The weather changing up, making it extra more challenging. Talk about extra more challenging.
Since the announcement of the Omicron variant on the 26th of November, numerous countries and territories have taken different approaches toward preventing its spread. The UK and the US shut their borders immediately, much to the chagrin of countries within the Southern African region who felt persecuted by the decision. On the 30th of November, the National Institute for Public Health and the Environment revealed that retests of samples that were taken on November 19th and the 23rd showed that the Omicron variant's existence was in the Netherlands a whole week before South Africa actually reported it, adding a new twist to questions about where and how the variant originated and whether travel bans on southern African countries is actually validated. Professor Mike Tildesley from the University of Warwick School of Life Science and Mathematics Institute agreed to an interview with Uncharted, and I raised some of my questions about the new variant and the international government response. I'll start with the most obvious question. Do you think that the international governments are actually warranted in their response?
So this is a really, really difficult call. And I think the problem with the Omicron variant is that there's a lot of unknowns at the moment. We've been seeing the situation in South Africa. There's really concerning rising cases, but there's still a lot of uncertainty as to that. Suggest it's more transmissible than other variants. Some suggestion that it might evade the vaccines a little bit more. But, this is what I'm saying as an epidemiologist in the UK. There's still a lot of uncertainty around this. Now, the problem, of course, with this is it's really difficult for those countries in Africa that are subject to these travel bans. The challenge I think the international community have is that any control policy, if it's going to be effective, has to be done as soon as possible. You can't afford to wait until you've resolved all of those uncertainties before you make a decision. And so that's why I think a lot of us have put in place these travel bans. But of course, I also appreciate this is really, really damaging for those countries in Africa that are affected.
Evidence has now arisen that the Omicron variant was actually found in Europe. Do you think that the response would have been the same had the variant been detected in the Netherlands, for example, as opposed to southern Africa?
Yeah, I think probably in a sense the response would have been the same, but probably differently targeted. This is the problem, that unfortunately new variants emerge all the time. Now, we had, of course, in my own country, in the UK, we had the emergence of what is now called the Alpha variant. At the time is called the Kent variant, which actually was first emerged in the south of England in late 2020. And of course, there were measures that were put in place in terms against the UK to prevent variants getting out of the UK and spreading into other countries. So those sorts of measures are put in place. Of course, the problem is, which is exactly what you say, it's where it is first detected. And if it's initially detected in a country that actually it turns out is not maybe the source, then the travel bans may be targeted to those countries where it is first detected. It's a really challenging time for the international community to put in appropriate responses to combat these new variants.
In previous interviews, you touched on the fact that a number of vaccinated South Africans is still quite low, and that could be one of the contributing reasons to the rapid spread of the disease there. However, it's fair to say that this picture is what exists in most African countries. Do you think that this is something that the West and Europe should then consider in dealing with these nations and these variants moving forward, especially when we look at the fact that the numbers of vaccine donations that had been pledged to economically struggling nations such as South Africa have not actually been met by the UK and the US?
I think it's really important that they do. And I think this has highlighted how important this is, that it's not just a national problem, it's an international problem. And we really need to do what we can. People in higher income countries with high levels of vaccination really need to work to support other countries with low levels of vaccine access, because by doing that, hopefully it will reduce the risk of new variants emerging and will also protect those citizens in lower and middle income countries who have very low access to vaccination at the moment. If we want to get out of this pandemic sooner rather than later, it's very, very important that we do what we can as an international community to send vaccinations to where they are really needed.
Research shows that this particular variant has over 30 mutations, about 50 to be exact. Do you think that this will make it more lethal or just more transmissible, or are we looking at both potential options here?
Well, to be honest, right now, I think we simply don't know. We are working really hard to try to understand what all of these mutations mean in terms of how transmissible it is, how well the vaccines are going to work, and how severe infection is going to be. Right now, there's a lot of uncertainty. The work that we're doing in the UK may suggest that it's transmitting faster than Delta, which is the prevalent variant here, but we don't yet know. We will learn more over the next couple of weeks as to exactly where we are, and this will hopefully guide national communities and international communities in terms of how best to put in any kinds of mitigations that might be needed to control the spread of this variant.
Let's talk money.
Monetary, there are monetary things that you can do, instruments that you can do. You can think around.
Its function is to boost and bring visibility to the work
Real
that
estate
we do
investment.
all the time.
Is something like we don't stop anymore, which is a small
Business policies.
We're coming up with policies, right, that will make
a long period of time to fully address a credibility deficit that has been eroded over a period of time. It doesn't
was able to raise about just shy of 1.5 lakhs, almost just there, meniscus.
So you find that
financial
you can come up with an idea, but don't think that people are sitting and just looking at
percent of the jobs in this country, in fact 67% of the jobs in this country are supposed to go to the private sector. You do not have a proper country where your highest paid people...
Every Tuesday at 8 p.m.
Host Yoella Chomba. Now, some of the most recent...
Catch Money Watch Weekly with Yoella Chomba.
...have been the appreciation of the kwacha that was caused by central bank intervention, and also...
Money Watch Weekly, only on Spring TV.
It's tough to say what to expect with this new variant, as it could take weeks for scientists and researchers to derive any conclusive proof on their speculations. And for many, weeks is likely to feel like an eternity, as this rising concern means more travel restrictions and prolonged distances between family and friends for the holiday season. Roshan Gelu is a Zambian national who resides in the UK. She hasn't been home to visit her family in the last 2 years and was relieved when the UK government finally removed Southern African countries from the red list in early October. But her hopes were dashed for a January visit when they suddenly announced that the Omicron variant was a plausible cause for concern. When was the last time you were able to travel to Zambia and visit your family?
That was 2 years ago, just before COVID. No, 2 years ago, yeah. I was supposed to come to Zambia in 2018, February, and then lockdown happened, and I haven't been since. No, 2019. When was the first lockdown? 2019, wasn't it? Yeah, 2019. Couldn't come and see my family, which was devastating. I'd booked my tickets to change my bookings, to get a refund. It was just such a hassle as well. But anyway, here we are 2 years later, still trying to come.
So then you'd already booked a ticket to travel in January, which was also canceled. So have you received any compensation for the payment you made from the airline?
I have received some money back, but they took off like £100 for administration fees. So I did try and argue it out, but they just said, oh no, we have to do this, we have to do that. And I couldn't have been bothered. I just left it.
So then what are your true feelings about the decision taken by the UK government? So as an African, as a Zambian, do you think that African countries were being punished after they were put immediately on the red list?
I do, because I don't understand how they put the African countries on the red list, and then the European countries like Spain, Portugal, and other countries, they're not on the red list. What I don't understand. So when you're coming to England, there's some people, well, the planes like will stop over in Spain or Paris, or so passengers are mingling together. They're all traveling on the same plane and they land in the UK. And then they saying, okay, you from the red list, you're going into isolation. You can isolate at home. Why? When they've all traveled together, they've all come from the same airport. Why are they being segregated like that? Just because they come from an African country, but they have traveled all together in the same aircraft. I don't understand it.
How do you keep yourself motivated? Because you've been so far away from your family for so long, and now you've got the holidays coming up. How do you keep yourself going?
I FaceTime, talk to my family all the time. Just FaceTiming, texting, just trying to keep my spirits up so I don't get depressed. At the moment, again, I have booked my ticket due to travel in January. And then there's all this, I'm not sure if I'm coming. And I'm going to feel depressed if I don't come, honestly. I haven't seen my family for 2 years. And then again, there's a lockdown looming above us. I don't know. I'll cry. I'm going to sit and cry if I can't come.
Yeah, I can only imagine. As of the 1st of December 2021, Saudi Arabia had confirmed its first case of the Omicron variant. Germany declared 4 cases in people who were fully vaccinated. The UK confirmed a total of 8 cases, while Israel, another one of the countries to immediately sever themselves off from Southern Africa, confirmed 2 cases. Over in Africa, Nigeria confirmed its first case in 3 passengers. South Africa was dealing with 77, Botswana had 19, and Zambia had none. Can we be honest now? Malawian President Lazarus Chakwera used the term Afrophobia in describing the travel bans imposed on African countries, and I dare you to disagree. Like any decision, options need to be weighed and methods need to be assessed. When it comes to this new variant, we need to remember that it was only just uncovered. There is no way of telling how long it's been around, where it originated from, if it's likely to cause more severe illness, or if it will elude our vaccines. If we sift through the doomsday rhetoric of the international media, we're likely to find that the Omicron variant has probably been coexisting with us for far longer than we actually think. The woman who sounded the alarm, Dr. Kutsia herself, described the moves as panicking unnecessarily because all the patients she had seen, about half of whom were unvaccinated, only displayed mild symptoms such as fatigue. Now, let's not forget that the Omicron variant has already been found in a dozen other countries: the Netherlands, Spain, Australia, Czech Republic, and Portugal, to name a few. But guess who remains on the travel ban list? Brazil is set to shut its borders to travelers arriving from 6 southern African countries. Cambodia said on Monday that it was banning entry to travelers from 10 African countries. Canada is closing its borders to foreign travelers who have recently been to 7 southern African nations. Ecuador will impose entry restrictions on travelers flying from or via a number of African countries, and the list goes on. Hong Kong, India, Ireland, Israel, Japan, Paraguay, Poland, and of course the US and the UK. Seeing a trend here? The explanation being delivered by the international community is that the bans are an attempt to slow the spread of the virus in order for us to better prepare ourselves to deal with it. As though the fact that we've probably been living with it for weeks worldwide means nothing. If Omicron is indeed more transmissible, I hate to break it to everyone, but it's likely everywhere by now. What we can do now is continue to follow the protocols and the restrictions and learn to live with the fact that for the foreseeable future, this is our reality. The virus will continue to mutate until it burns itself out, and we just learn to live with it just like the flu. If you ask me, the best way to keep yourself safe, get vaccinated, wash your hands, wear your mask, social distance, and switch off your TV. Good night.